Hello, everyone, and welcome. I'm so delighted you're with us here today. I'm Kathy Roth UK, the CEO and founder of Blue Star Families. We are your military family, veteran family organization here to support you in your military lifestyle journey. Throughout the pandemic, we've walked beside you, getting answers to your pandemic-related questions from leaders in our government and military. Throughout this hour, you'll hear from our leaders about what's going on today. We have the opportunity for you to submit questions through our live chat feature on our website. If you are watching us on one of our other hosted live streams, either through the DoD or Military Times, and you have a question, you can come to the Blue Star Families website to submit to the chat. We've also collected your questions upon registration. Blue Star Families is very excited to carry this content today because we care about our force and their families. We want to help keep you and your family safe. We want to help you get the answers you need. We are all about collaboration, and we are very grateful for the scientists, the experts at the Department of Defense, at the VA, and throughout government who are joining us today. And with that, it is my great pleasure to introduce a friend of Blue Star Families and our military community, Dr. Tony Fauci. Dr. Fauci, thank you so much for joining us a third time. It is a real pleasure for me to see you. I know you know, and many of our viewers know, that COVID has had an outsized effect on our military force, not only because it disrupts our lives more than most because of the impact on our PCS moves and getting resettled into communities, but National Guardsmen are deployed at an unprecedented amount battling COVID. Just recently, the president activated 1,000 more National Guard members on top of the Guardsmen activated by local state forces, creating a bigger burden on the mission. And so getting the pandemic under control means a lot to our mission. It means a lot to us that you're here today. Can I invite you to kick us off with a few words before we get to questions?
Yeah. Well, thank you very much, Kathy. It's really a great pleasure. Really, I mean that, to have the opportunity to interact with such an extraordinary organization, given the profound respect I have for our military and our military families. We're dealing, as we all know now, with an unprecedented outbreak with COVID-19 that continually re-challenges us with new variants. We've gone from the original strain, the ancestral strain, through Alpha and Beta and Delta, and now we're dealing with Omicron, which is very unusual because of its extraordinary capability of spreading so efficiently from human to human. We are now having record numbers of cases, record numbers of hospitalizations, and we are still at a situation where we're approaching about 2,000 deaths or so per day. So even though there are things we can chat about in our Q&A and our discussion about the nature of Omicron, as the fact that it is known now through multiple observations in different countries to be inherently a bit less severe, nonetheless, the sheer volume of infections is making this a real challenge. So just with that as a brief introduction and expressing my delight at being with you, I'd be happy to answer any questions that you have. So thank you.
Thank you. I have a lot of questions, so I'll jump right in because I know people are waiting. When do you think, if you can say, when do you think the current surge will peak and decline?
Well, Kathy, it's not going to be uniform throughout the country because we have different dynamics in different regions of the country. Right now, there's no doubt that in New York City and other parts of New York State and in New Jersey, it has already peaked and is rather dramatically on its way down. We're seeing that also in bigger cities, such as Chicago, whereas in cities in the South, it has not yet peaked and likely will have more of a slower incline and a slower decline, such as in places like New Orleans and in other cities in Louisiana that I've had the opportunity to have good conversations with our health authorities down there. Getting back to when the entire country will be in a situation where it turns around, I think, as I mentioned, we're already starting to see that in some cities. I would imagine as we get into February, into the middle of February, first few weeks of February, it is very likely that most of the states in the country will have turned around with their peak and are starting to come down with regard to cases and then obviously hospitalizations.
Is the warmer weather our friend with this, or is it not really related?
Well, I'd put it another way, Kathy. The warmer weather may not be our friend, but the colder weather is definitely our enemy. And the reason I say that is that this virus, unlike other respiratory viruses, does pretty well in the warm weather. When people are outside as opposed to inside, any respiratory infection is less likely to spread, since respiratory infections spread where there's enclosed places with poor ventilation. You get that mostly in the winter because of the colder weather throughout most regions of the country. And that's one of the reasons why one of the tenets of good public health practice is that when you are indoors in a congregate setting, even though you're vaccinated and boosted, you still should wear a mask.
Makes a lot of sense. So thank you. This next question is mine. I snuck it in, but a lot of other people asked it too. We hear a lot, we need to learn to live with the virus. But what exactly does that mean? And do you think that's true?
Well, it's true in some respects, as long as you don't overinterpret it. When you say live with the virus, you mean to get the level of spread in the community with its subsequent impact on severe disease and hospitalization, that you get it to such a low level that, in fact, it is indistinguishable from many of the other respiratory infections that we've learned to deal with and live with, like respiratory syncytial virus, RSV, parainfluenza, adenovirus, and influenza, of course. So getting it down to a low enough level that it doesn't disrupt our lives, our economy, and doesn't create continual fear of illness, severe illness in the community. For one thing is for sure, Kathy, we're not there yet, because when you have 156,000 people in the hospital and 800,000 new cases a day and 2,000 deaths per day, that's not a level that we want to learn to live with. Right. We've got to get that level much, much lower than that.
Yeah, that's a very clear, I think, an important message for us. And it leads into my next question. For individual families, what's the best way to keep a family safe when we leave the house right now?
Well, there are some fundamental tenets of public health with COVID that I know many of the families are already practicing, is to get vaccinated. And if you are vaccinated, make sure you get your boost within 5 months if it's an mRNA and 2 months if it's a J&J. The other is to be very prudent in what you do. For example, if you go into congregate settings, indoor congregate settings, and you do not know of what the status is of the people around you, absolutely wear a well-fitted, high-quality mask and wear it consistently. The other thing that you could do is that when you're engaged in social interactions, like you're having family dinners or friends over for dinner, if you have the opportunity, you might want to take the extra step of getting a rapid test, one of those antigen tests, which are not 100% sensitive, but they are very helpful in giving you a feel, particularly if you do more than one test, as to whether or not you might have an infection that's without any symptoms that you might inadvertently spread it within the family unit.
Terrific. In terms of children, should we be using N95, KN95 masks for children right now? And is there a difference between those two options?
Well, the most important thing for anyone is to wear the highest quality mask that fits well and that you can tolerate. Namely, you don't want the very, very best of the mask and you can't keep it on for any more than 10 or 15 minutes. So it's a combination, the best mask you can get, and the order of gradation is N95, clearly the best, KN95 next, multiple ply surgical masks, then cloth masks if you get a good fit. The one thing that the CDC says that's very important is that any mask is better than no mask. That's the first thing. And if you're going to wear a mask, one needs to be well fitted, which gets to your real question is, what about children? We don't have really standard, easily available N95 masks for children. We will be getting them, and they're being ordered and will be distributed, not only N95, but KN95. For a child in which you don't know what to do, if you get a multiple ply mask, that's a cloth mask that fits to the child, that's the best thing. If you can get a children pediatric surgical mask, that would also be good.
Well, wonderful. So here's one. For a soundbite, if someone had only 30 seconds with someone, what do you think is the most compelling argument you found to persuade someone to either vaccinate or wear a mask?
Yeah. Look at the statistics. They are stunningly impressive. If you look at people who are unvaccinated compared to vaccinated, the latest statistics are an unvaccinated person has a 10 times greater chance of getting infected, a 17 times greater chance of getting hospitalized, and a 20 times greater chance of dying compared to a vaccinated person. Those statistics alone should get you to be really enthusiastic about protecting yourself and your family. Also, masks clearly now have shown to be very effective in not only protecting you from getting infected, but protecting you from transmitting it to someone else.
Yeah, those are really compelling numbers. Would you just tell me the numbers one more time? Because I'm going to use them as a minute.
Okay. Unvaccinated compared to vaccinated. Unvaccinated has a 10-time greater chance of being infected, a 17-time chance greater of getting hospitalized, and a 20 times greater chance of dying when you compare it to a vaccinated person.
Yeah, right. 10, 17, 20, or 1, if you get it right. I like it.
Okay.
So we talked about getting the booster 5 months after the mRNA, 2 months after the J&J, but what happens after 2, 5, 6 months after that booster? Are we doing that 4th shot?
We don't know that yet, Kathy. That's a great question, a very appropriate question. We do not know at this point what the durability of the protection afforded by the 3rd shot. We're studying that very carefully. If the protection diminishes, and I mean clinical protection, because without a doubt, the antibody levels will go down. That's a natural phenomenon. You get vaccinated, you get a high level of antibody, and it starts to come down. It has to be that way. Otherwise, you would have such high levels of antibody to every single thing you get exposed to that you'd wind up having a difficult physiological problem. However, the critical issue is how long does the protection against significant disease last? And significant disease is highly symptomatic, in a hospital, or dying. That's the thing you need to worry about, as opposed to the number of cases that you prevent, particularly if many of the cases are without symptoms.
If someone's gotten Omicron, they got their first shot, their second shot, they got their booster, they've gotten Omicron, should they have a higher degree of confidence about their protective factors, or are they really just at the same place that someone who hasn't gotten sick?
No, actually, that's a good question. If a person is infected and recovers and then gets vaccinated, the level of their protection is extremely high. Mm-hmm. And also, if someone gets vaccinated, boosted, and then gets a breakthrough infection, the level of their subsequent protection is very, very high. So natural infection, with or without vaccination, is good protection, but natural infection followed by vaccination really gives you a very high level of protection.
And I do hear from folks, I've gotten it once, I've gotten it twice, I don't need to get vaccinated. Can you respond to that?
Yeah, I mean, I don't think you can deny that if you've been infected even once or twice, that you're not going to have a degree of protection. You will, that's just a fact. But if you want to get an optimal degree, an even greater degree of protection, there's no doubt that vaccination following infection gives you a very high level of protection.
Dr. Fauci, I know you know that a lot of people in the country are weary, but no one has a right to be any more weary than you do, because you've been working with this longer and harder and deeper and with a lot more thesaurus than most people have. So right. How do you keep your energy up in your positivity? What can you offer to folks to keep ourselves positive?
Well, I'm not sure I can offer it to regular people who are out there doing their things, because what I'm doing is something really unusual. It's my responsibility to not only protect myself and my family, which we do by vaccination and mask wearing and boosting, et cetera, but it's my responsibility for the science and the public health to protect the entire nation, and indirectly, really, the rest of the world, because the United States is such a leader in the global health response to this pandemic. So I stay very, very focused. And although it's exhausting, and although I really literally haven't had a day off in 2 years, the fact is, if you focus on what your goal is and what your responsibility is, you don't have time to think about being exhausted or being tired. You just want to end it, get it over with, get the country back to normality, and then I'll worry about taking a rest.
You know, I think that resonates a lot for me and probably for a lot of our community, because for those of us who are part of the military community, we're very motivated around the mission of protecting people in the country. For those of us at Blue Star Families and our other military and veteran support organizations, we're really motivated around supporting the force. And we see that this pandemic is a threat to our force, it's a threat to our readiness, and it's a threat to our missions. As I mentioned, we're using the National Guard, which is not inappropriate, but we're using them to fight COVID at home. That means they're not available to train and be prepared for external national security challenges. And because we live in our communities, we are constantly exposing our force to the risk of being infected, which if we could all get together and create community level protection, we wouldn't be at risk for. So maybe for those of us in our community, we can take that same mission focus to keep our energy going, because we're doing something bigger than our day-to-day lives, right?
Well, that is true. I think that the idea of sacrifice and devotion to a cause is really the hallmark of the military and their families. So I think we're very much in the same boat in that regard.
Yeah. Would you consider the vaccine to be putting something unnatural in your body? This is something that I sometimes hear. I don't want to put something unnatural in my body.
Well, what's more unnatural than the vaccine is actually the infection itself. So, I mean, I think people need to understand that using the word unnatural is really inappropriate. You're doing something that before it goes into the general population has been tested on tens of thousands of people for safety and effectiveness. And right now, globally, we've distributed about 9 billion doses of the vaccine. In the United States, you know, we have literally hundreds of millions of courses of vaccinations that have been delivered. We have 63% of the entire population has been fully vaccinated. 72% have received at least one dose. We have a lot of experience. So people who say, well, I'm not quite sure about it, this is something unnatural, just look at the experience together with the data that I gave you about the difference between an unvaccinated person and a vaccinated person with regard to disease, hospitalization, and death.
Here's another question. Could you explain scientifically or medically how the Omicron variant affects individuals differently than the original variant or the Delta variant affected people?
It doesn't really affect them in a substantially different way, because the way you get infected through the respiratory tract, you can either be without symptoms, mildly symptomatic, or you can get severely ill. The one thing that is somewhat of a positive is that on a case-by-case basis, in data that we've gotten from South Africa, from the UK, and now a lot of accumulating data in the United States, indicates that on a case-by-case basis, Omicron is less severe. In other words, less likelihood of being hospitalized, shorter time of duration of being in the hospital, less of a requirement for mechanical ventilation. That's the good news. The sobering news is that Omicron is so extraordinarily efficient in spreading from person to person that the sheer volume and numbers of infected people can counter and obviate the positive aspect of it being less virulent. For example, as an analogy, if you have an infection that infects 50 people, and 10% of the infections are serious, then you have 5 serious infections. However, if you have a virus that only 1% of the people get serious, but 500 of them are infected, you add the math and you have more seriously infected individuals than with the less virulent virus. That's why we can't be complacent when it comes to Omicron.
Will Omicron or Delta come back in a wave, or once they come and go, they're gone?
Well, one of the things that is peculiar about coronaviruses that's different than smallpox or measles is that smallpox, once you get infected, you're protected for life. Mostly because smallpox doesn't mutate very much or change. So if you get re-exposed to smallpox, you're not going to get reinfected. The same holds true for measles. Measles, once you get infected, you are protected for life, mostly because measles doesn't change that much. The reason I can't say the same thing for Omicron or for Delta is that the durability of the protection isn't lifelong. So you could be protected for a few months, 5 months, 6 months, 7 months, a year, 2 years, who knows, but it isn't lifelong. So there is the likelihood that if you get exposed over a period of time, that you might get reinfected, which is the reason why, getting back to a previous question you asked me, why it's important, even though you have been infected with Delta or with Omicron, to get vaccinated, because then you would greatly heighten your degree of protection against reinfection.
Yeah, that's great. That's great information. That's a great perspective on it. With all risks, there are countervailing risks, right? And other one by following one, by being prudent in one area, we expose ourselves to risk in others. Military families, as you know, face a lot of disruption, a lot of family separation. Sometimes if a member of the family contracts the disease and quarantines from the rest of the family, it creates an additional separation. And I'm thinking particularly of the situation where you have a family that may be far from extended family and relatives, a young child who may be 1, 2, or 3 years old, and a mom who may get COVID. Are there risks to separating that child from the mother for 10 days, 2 weeks, that can feel very real, can feel psychosocial, that might make you feel like I'd rather keep the mother and the child together than I want to separate them because of the risk to the younger person? What are your thoughts about that?
That is a natural feeling, very understandable, but something we have to deal with. Because if you look at the effect of COVID on kids, it was felt to be, not particularly important. Well, it is true, if you want to be perfectly frank and candid about the data, that a child who gets infected is much less likely to get a severe manifestation of COVID. However, the risk is not zero. And we have plenty of children, when you look at children's hospitals throughout the country, plenty of children who are severely ill with COVID-19 requiring hospitalization, some even dying. So although the risk is less than in an adult, you have to balance. And you're right, people make decisions based on the relative risk that they're willing to take. You would recommend that if you could tolerate a brief separation from the family during that period of recovery, then do it. If it becomes impossible, then you have to assume the risk of spreading it to the child. Those are just real world issues you have to deal with.
I appreciate that. And I appreciate the compassion and reality in that answer. I think that's really helpful to people. And so related to that is, do you have any updates about when the vaccine for children under the age of 5 might be available?
Well, Kathy, I hope very soon. You never want to outguess or get ahead of the FDA, but the studies that were done showed that the dose that was used in kids 6 months to 24 months was the correct dose that showed that that was not inferior to the response in adults. However, in a very disappointing way, the dose that was used for children 24 months to 4 years did not induce a response that was felt to be adequate. So they're determining now that for children within that age group, it is likely that it will be a 3-dose vaccine. And that being the case, it's going to take a little longer to get those data to the FDA and approved. My hope is that it's going to be within the next month or so and not much later than that. But I can't guarantee that because I can't outguess the FDA. I'm going to have to leave that to them.
I know we're almost out of time, but I'll ask one more question and then let you make any closing comments you'd like to make. Are we anticipating getting the vaccine in a pill form or a non-shot protocol for people who are uncomfortable with that?
Well, unlikely it will be a pill, and more likely would be something where you spray like the flu mist with influenza.
Okay. Right.
So I don't think it'll be necessarily, although it's not impossible, it won't necessarily be something where you swallow as a pill, but more likely something that you could put a patch on you and it penetrates in the skin, or spraying in the nose or in the throat that might actually do that. And there's a lot of good research going on right now to try and develop an alternative type of vaccine that doesn't require an injection.
Fantastic. Dr. Fauci, I need to let you know that we have had literally tens of thousands of people join us to hear you speak to us today. It really means so much to our community to have the opportunity to directly ask the questions. And so I know you're so very busy, but we really are so grateful for you sharing your time and all the information with us.
Well, thank you very much, Kathy. It's not only my pleasure, but I consider it an honor to help in any way that I can with the military and their families.
All right, good. I hope we get to see you again, but not in the middle of a surge.
Right. Very good. Thank you very much. Take care. Good luck.
Thank you. Bye-bye.
Bye-bye.
Well, I know you join me in thanking our government and military leaders for joining us in this journey. And we are now very honored to have a very special guest, the Secretary of Veterans Affairs, Dennis McDonough, who has been with us on this journey for a while. From the beginning of his time in office, Dennis McDonough and his team at VA have put the pandemic in their crosshairs and have worked very hard to try to keep our veterans and their families safe. So thank you, Secretary McDonough, for joining us and saying a few words today.
Good afternoon. Kathy, thanks for getting us back together, especially during this Omicron surge. You know, the best advice I can give everyone is this: listen to Dr. Fauci, follow his guidance, listen to your personal care providers, follow their guidance. Why? Because it's the best way to keep yourself safe, the best way to keep your family safe, because we owe it to each other to help keep everyone safe. And you know what? Because we owe it to our nation's incredible healthcare workers. Since the pandemic hit, they've been risking their lives nonstop for you, for me, for vets, for our country, for all of us. That's no exaggeration. It's been nearly 2 years since we started celebrating their courageous, tireless service as the pandemic gained a foothold. Remember, People in New York City banging pots and pans at hospital shift changes to show their gratitude to healthcare workers? Well, people aren't banging pots and pans anymore, but those great medical professionals are still at it in New York and across the country. They haven't let up. Day after day, night after night, they're still risking their lives, their families' lives, for us. And nowhere is that more true than among our VA employees, serving veterans, their families, and their caregivers, serving you, your families, your caregivers. They're working grueling, excruciatingly long hours to save lives. They've vaccinated more than 4 million veterans, 80,000 spouses, and 21,000 caregivers, boosted more than 1.2 million veterans. It's hard and risky work, particularly now. Here's how we know. We track it. Earlier this month, on one day, there were more than 15,000 VA healthcare professionals unable to work due to COVID. Now, the previous high on this metric was in December 2020, when there were about 6,000 unable to work due to COVID. They've been traveling across the country to places they're needed the most, leaving their families behind to do it. In fact, over the course of the pandemic, VA personnel have deployed beyond their duty stations over 5,000 times, helping care for veterans and their people in their communities. And when non-vets need their help, they've stepped up as part of our fourth mission to help COVID patients in need, all while never once denying a bed to a veteran. In fact, right now we have made about 130 beds available to non-veterans in 10 different states. In short, they're showing their immense strength and determination under the most difficult of circumstances because of their enduring devotion to veterans. I am so proud of them and so thankful for them, as I know we all are. And the best way to show them gratitude these days isn't by banging pots and pans. It's by following Dr. Fauci's advice. It's by getting vaccinated or boosted. Why? Well, it's simple. It's the most important thing we can do to protect our veterans. It's the most important thing we can do to protect our active duty forces. And we owe it to those who are giving so much of themselves for you and for me. And we owe it to ourselves because ending the spread of COVID-19 is our call to service. And it's the right thing for us to do. You'll find a lot of helpful information on our VA website at the address you see here on the screen below. We can get through this. We'll do it together. Thank you. God bless you. God bless our great VA employees, and may we all serve veterans as well as they have served us.
Secretary McDonough, that was really great. And I really appreciate those words. And it means so much that you show up for us and for our whole community. So thank you. And now it's my great pleasure to introduce someone new to this forum, Major General Paul Friedrichs, who's the Joint Staff Surgeon at the Pentagon. When we asked around who is one of the most trusted voices among active duty military, we heard Dr. Friedrichs. We heard that from people throughout the Pentagon and throughout the press corps and in the ranks and field. So Dr. Friedrichs, we're really delighted that you can join us today and give us some advice and some insight from your position. And it's so great to get a chance to meet you. Thank you.
Well, thank you very much, Kathy. And let me start by saying how grateful I am for what you all are doing and how valuable forums like this are. And this is not just me speaking as the Joint Staff Surgeon. This Thursday, my dad turns 95. He was a World War II Navy vet. My wife is a VA doc, former Army doc, and we've got a younger son at the Naval Academy right now. So I'm part of your extended Blue Star family there, and so grateful for what you all are doing. And I'm grateful for the chance to share an update. And I want to speak really from the operational perspective. You know, the great news in all of the challenges of this pandemic is that our military has continued to defend our nation for the last 2 years, in spite of all of the challenges that we faced. And in large part, that's due to you all at home, making it possible for those of us who are still in uniform to do what we have to do. And so, you know, you'd asked the question of Dr. Fauci earlier about how do families get through this? Please know how incredibly grateful we are for the sacrifices you all are making so that we can do what we're doing. You know, there's not a day that goes by, especially with this surge, when we've got tens of thousands of people out sick, that we don't have the discussion. But what about my kids? What about my spouse? What about school? And I can assure you, all the way up to the level of the chairman, those are things that we think about, and we know that you're there helping us get through that. So let me say thank you on behalf of all of us here who are working with you to continue to support and defend our nation. The other part that you're helping us do is to take care of those who need medical care. So you just heard from Dr. Fauci, who I first met in 1989 as a medical student, and what an incredible servant leader he is for our country. And you heard what the VA is doing. But as many of you know, the DoD is also stepping up again. So we had about 400 people deployed last week, helping hospitals around the country. We've got another 500 going out the door this week, and another 500 military medics going out shortly behind that to help hospitals all over the country. That's important for many of you all because you rely on the DoD healthcare system for care. And if those military medics are not at home taking care of you all, that is going to have some impacts. And we know that, and we're very aware of that. But we also know that during this great need and challenge that our country is facing, the DoD is who the country turns to for support. We also know, and you mentioned this, Kathy, that the National Guard is playing a huge role. We've gone from 12,000 guardsmen and women deployed a month ago to now close to 20,000 Guards members who are stepping up, many of them medics, but also across the many capabilities that the Guard brings to help their communities. And that has an impact to help the communities, but it has an impact on each of your families as you're supporting that Guards member or that active duty member who's deployed. And so I'll say thank you for that again. I get asked a lot, what can we do? And I think you asked Dr. Fauci that, and I'd echo what you've heard already. The most important thing that we'd ask you all to continue to do is keep faith with your service members. If you're a military family, you know, none of us would ever have hoped to live through something like this. This happens once every 100 years. Hopefully we'll never see it again. But please know, we all want this to be over as soon as possible. And you're helping us when you get vaccinated. You're helping us when you make sure that kids are able to go to school. You're helping us as we fight through this latest enemy that we face by making sure that those common sense things that Dr. Fauci talked about, not having the big parties, as much as we would all love to celebrate things, as much as we want this to be over with, so that your active duty service member or your guardsman or your guardswoman in your family there is able to continue to do the things that our nation depends on them to do. Now, the last thing that I'll leave you with is, in the very best of times, we ask a great deal of our military families. We're asking even more now, and we know that. Please, please, please keep using forums like these to ask your questions, share your concerns, bring them forward, whether it's the SEAC through your command chain or reaching out directly to me, so that we know where we are making it more difficult and where we need to try and fix things, because we need you all desperately to help us get through this. Thank you again for all that you're doing. God bless you all. Thanks again, Kathy.
Thank you, General Friedrichs. And now that we've met you, we're not going to let you get too far away. So we look forward to seeing you again soon. But I have to say, I found those very moving words, and I know I'm going to hold on to them too, that this is a special calling for those of us connected to the military to keep the fight going longer. And to not, if I may borrow a phrase, not put down our packs yet because of the role we play. So good words. And now it is my pleasure to bring back our great friend, Kobe Langley, Senior Vice President of Services to the Armed Forces from the American Red Cross, to speak again with Lieutenant General Ronald Place, Director of the Defense Health Agency, to once again answer more questions and get more answers part of the community. I want to thank you, Kobe, General Place, for joining us once again.
So, Kathy, as always, thanks so much. You've been an amazing partner to the American Red Cross and an amazing leader to our veteran military family community. It's always a pleasure to be here talking with you and senior leaders about this really important issue. It is the most important issue to our veteran military family community. General Place, it's good to see you again. The world's changed. It's very different than what it was, even 3 or 4 months ago. Omicron is all over the place, and our veteran military family community are concerned. We're doing what we can to be vaccinated. I'm super proud of our Red Cross team. We're over 90% vaccinated. Of course, the military has done an amazing job of getting almost the entire active force vaccinated. That's thanks to your leadership and of course, the leadership of our Secretary Austin. We're here to ask you some questions about what's changed.
Well, yeah, thanks, Kobe. And thanks again to the American Red Cross and the Blue Star families for hosting this town hall. My personal view, you've been extremely helpful throughout the pandemic, ensuring our military families and our veterans get the most current and accurate information and from good sources, the right sources. There's a lot to cover in our discussion, but if I could open just a little bit of background information on where we are in responding to the pandemic. Like the rest of the civilian healthcare sector, the Department of Defense has been affected and is being affected by the spread of the Omicron variant. Positive cases are up. We've seen the number of hospitalized patients with COVID-19 also go up, but consistent with the national trends, a much smaller percentage of inpatients are requiring intensive care unit care. That's good news. In our hospitals, at least, the vast majority of people hospitalized with COVID are unvaccinated still. Since the vaccines have become available to all of our service members and families, with one exception, our only deaths of those in uniform were among those individuals who had not been fully vaccinated. The one service member fully vaccinated received the single dose J&J vaccine a long time ago when it originally came out. So the point to all that, why did I give you all the data? The point is the vaccines work and their safety profile is extraordinary. We may get into that a little bit depending on what your questions are. So the bottom line, if you listen to nothing else, not only for yourself, but for your families or community, I strongly urge everyone to get vaccinated and get a booster when appropriate. Now, for the military health system specifically, we also have healthcare staff who are out sick and following isolation procedures or in quarantine, and that's a challenge. Vaccination is a requirement for our healthcare workers, both civilian and military, and we're encouraging boosters to our staff as well, which minimizes illnesses amongst our team and protects for our patients. And then finally, for the broader national response, the Department of Defense still doing an awful lot. One of the first things that Secretary of Defense Austin communicated on his first day in the Pentagon, and really within the first couple of hours that he was even in the building in the job, is that the pandemic was a national security threat, and that the Department of Defense would be part of the whole of government response. And I'll acknowledge that our military medical personnel have answered and continue to answer that call. In addition to the millions of vaccines, we talked about that last time, what's going around and who's doing it. We've helped staff overwhelmed civilian hospitals continue to do that to this day. We've shared masks and other personal protective equipment with our civilian colleagues. We've deployed hospital ships and combat support hospitals to some locations, mass vaccinations, right? The list goes on and on and on. We're proud of that. At least I think it's likely apparent that I'm really proud of our entire military team, soldiers, sailors,
Totally.
airmen, Marines, guardians, medical and non-medical, who've been out there side by side in our communities, getting people vaccinated and taking care of those who fall ill. Now, I know that many people are tired and just want this to be over with, but the pathway to a safer place is vaccinations and where appropriate boosters. And if more boosters or additional doses for the immune compromised, the number one thing is vaccinations. So, Kobe, thanks for having me here today, and I look forward to the questions.
So, General Place, thanks so much again for that, for that amazing introduction. And I agree. I mean, the amount of work that DoD did to get this workforce, total force ready and vaccinated was truly amazing. And your leadership and Secretary Austin's leadership was exactly what was needed at this critical time. But, we now know that vaccines are widely available to all Americans. And our communities are really curious as to whether vaccines are available in a different way to our military and veteran connected families, perhaps at DoD facilities. And what about boosters?
Yeah, well, sure. Great question. I think the number one thing is that we have plenty of vaccine, primary doses, second doses, boosters. It's not a supply problem. The only problem could be a desire problem, right? Are people willing to be vaccinated? But it's out there, and we have it everywhere. And in fact, we have all of the kinds available in America, the Pfizer kinds, the Moderna kinds, the J&J kind. The one thing that I will tell for all of our beneficiaries is that while some locations may only have one kind, most have more than one manufacturer, I guess is probably the right way to say it, more than one manufacturer. Some will only have one, but it'll never be the J&J one if it's the only kind. Just based on the efficacy of the difference at the mRNA vaccines, if you look at the CDC guidance, it's the preferred ones, but for those who want the J&J, we still have that as well. So it should be there. Now, the way to do it, at least in our facilities, my recommendation is go to the Military Medical Treatment Facilities website. It'll tell you what are the hours, do you have to make an appointment, is it walk-ins, how does all that work? All that information is available on the individual websites of the medical treatment facilities in question. And there's also the frequently asked questions and all those sorts of things. So people who are curious about what does it mean, how does it work, how long it's going to take, those sorts of things. Now, one point that I'll make relatively clear, though, our MTFs, I think are for our active duty service members or activated Guard and Reserve men and their families. It's for retirees, full retirees and their families. In many cases, it's for our DoD personnel who are able to get this vaccine on our installations, and appropriate contractors where it's been approved for this contracting organization. But non-retired veterans should seek vaccination in a VA facility or in their civilian communities, because we're not authorized for non-retired veterans to get their vaccinations with us.
That makes perfect sense. I appreciate that guidance. And, I went on the Walter Reed website, and I also went on the Fort Belvoir website, and you're right. It's right there. All the information is available about how to set an appointment and the availability. So appreciate getting that guidance directly from you. So General Place, that was, again, amazing information. We do know that our military communities are diverse in terms of where they live as well. Not everybody lives on military installations anymore. A great members of our community live outside the installation. Over half, right, live off installation. And so when military members have to rely on their local community needs, if the DoD facilities aren't accessible to them, where should those military families go?
Sure. So for anyone who either doesn't have access to an MTF or chooses, just for convenience sakes, they want to do it somewhere else, my recommendations are these. First, find a local pharmacy. And again, most communities have that available on a community website as well, but find a local pharmacy. The advantage of pharmacies, it is almost never that there's a copay that's associated with a pharmacy. You can also get it at your primary care providers, but there's sometimes copays associated with getting vaccines and other care within the primary care provider, your PCM's office. So the number one recommendation is a pharmacy. If you have other things that you need to do with your PCM and it's just more convenient, get it at your doctor's, your PA's office, or wherever it is. But that's the other way that folks can get it.
That's super helpful. Yeah, that's where I got, my 3 doses and, my 2 doses and my booster. I got it at the local pharmacy, and you're right, there was zero copay. But that's really good advice. I think, sometimes people might want to go to the primary care provider, and that's okay too. But you may have to do the copay with that. So thanks for that helpful information. So General Place, it's been amazing on how quickly and rapid testing has become an issue in the community writ large. And I know it's an issue and it's a challenge for the entire world and the United States. But it's so important that we have available testing, particularly because of the speed, of this variant, how quickly it's spreading across the United States and the globe. And so we're really interested in learning more from you about the availability of testing at DoD facilities for service members, and then what about family members and their dependents?
Well, I appreciate the question. Of all the things that we may be talking about today, while it seems simple, right? It's a test. Let's just do a test. It may well be, at least from a bureaucratic perspective, the most complicated topic that we're going to talk about. I think everybody knows, but for those who don't, there's really two different kinds of tests. There are laboratory performed tests. You go in, you get a swab, and somebody else takes care of it. And then some that are self-administered. So let me walk through the process just a little bit. So first, for the provider-administered tests, those that we go to someone's office, they do a swab, and they take care of it. For DoD beneficiaries, at most of our DoD facilities, we provide that. It's called PCR, or polymerase chain reaction, PCR testing for service members, families, retirees, anybody who's eligible for care within our system, we can do all that. If they're your regular provider or someone in the community says that, yes, it's necessary for you to be tested for it, that's something that we can do. It's called a provider-ordered test. That's the easy part. It's a complex test that we do, but from the beneficiary side, it's pretty easy. The second, the over-the-counter self-administered antigen test, there's all kinds of different approaches, and I think this is where the challenge will be for understanding. Now, some towns, some communities have made them free of charge for people in their community. If that's happening in your community, then by all means, make yourself available to them if that's something that's of interest to you. On the other hand, some are available online. For our patients, almost always you have to pay for those that are online. But for the TRICARE program, that's not the way our system works. For us, for TRICARE to cover something, any sort of test, we'll talk specifically about COVID tests, but any sort of test has to be determined medically necessary by an authorized provider. And a lot of that's because of TRICARE law that we have to follow. Now, the TRICARE health plan provides all kinds of different ways. So if it's based on symptoms, your provider could say, yes, you need a test. Or you're going to have a surgical procedure, for example. So you don't have any symptoms, but before you go in the hospital or before into the ambulatory surgery center to have something, you don't have any symptoms, but we want to make sure we're doing it at a time that's safest for you and safest for the healthcare team that's going to be providing the surgical care. That's medically necessary. We're going to test you before you have it. So for whatever your provider says is medically necessary, that's also easy. It's covered by TRICARE. It's no charge to the individual beneficiary, and there's no limit. There's no limit per day, per week, per month, per year. Medically necessary is medically necessary. Now, what we're trying to work through is the latest guidance on at-home testing kits, what the CDC is saying, what the federal government and the White House are saying, and is there a way for us to include those who are covered by TRICARE to be part of that? The absolute moment we have some sort of change, and other than medically necessary, we'll put all that on our website. We'll probably have some sort of public affairs announcement, that sort of thing. But for now and for the foreseeable future, it's only if it's medically necessary and authorized by a TRICARE appropriate provider or someone within our system. And then finally, a little bit of a word about those antigen tests, those at-home tests. There is a high number of false negatives, meaning that it says that you don't have COVID, but that you do. So if you feel sick, you should still isolate, right? I mean, you're sick. So if that's the case, isolate yourself and then consider, if you're still sick 24 hours from there, another at-home test or perhaps an appointment now with your primary care provider and get one of the provider of the PCR tests within our organization. So those tests, if you're positive, you're positive. But if your antigen test is negative, there is a potential that it's a false negative and you still may have it.
Okay, so General Place, I heard some really interesting and important information there, so I just want to recap it really quick. One thing you said, which I thought was particularly important, was the fact that if you get a test outside of the DoD TRICARE system, if you don't go see a TRICARE provider, you're probably going to have to come out of pocket for that test. I think that is a really important point, even if you're doing at-home testing. and that at-home testing right now, because it doesn't, unless it's recommended by a TRICARE provider, it's not going to be covered by TRICARE, which I thought was an important point. And then you also talked about false negatives and false positives, which I thought was really interesting. What you said was, it doesn't really matter if you take an antigen test or a PCR test. If you're positive, you're positive. I don't know that most people really know that. I think when people think of the antigen test, they think that it's just not as accurate. But I think it's really important, because if you get that positive, then you really do have to take the time that you need to recover. And I think that's really important.
Yeah, exactly right. Thanks.
So sometimes these conversations happen without any planning. You're just sitting down, talking with a friend or talking with a family member, and you want the pitch. So what in your mind, you've been now at this for years, fighting this terrible, terrible pandemic, help us communicate the most compelling argument to persuade somebody, please get vaccinated and or wear a mask.
Well, sure. As a physician, I can tell you simply, vaccines really work. The evidence that vaccines reduce the risk of being hospitalized or dying from COVID is overwhelming. The reduction is huge, but not perfect. Vaccination reduces the risk of transmitting COVID to someone else. Vaccinations are key to all this, and just as strong as the safety or as the efficacy is the safety of them. The number of adverse events from these vaccines is extremely low, and much better than the short and or long-term effects from getting COVID. I tell my family the same thing I'm telling you. If you do nothing else, get vaccinated. On masks, as a surgeon, as a general surgeon, I've worn masks in the operating room my entire adult life. They are a layer of protection to help reduce or even eliminate the spray of droplets and the viruses that they contain when we talk or cough or sneeze. Worn correctly, though, N95s, KN95s, KF94s, they're much better protection than a cloth or a surgical mask. But if you're going to buy them, make sure that you buy them from a reputable source. There's some counterfeit masks out on the market, so just be careful about that. I hope that was 30 seconds. I don't know how long it took me.
That was perfect. And again, I just just repeating the safety of them and the efficacy of them. I think that you're right. I mean, we can try our very, very best to convince people, and hopefully they listen. So this is about Omicron and the challenges that Omicron presents right now. And the thing that's most concerning, I think, to people is, how do we keep our families safe? Is it different than what we've been doing before because Omicron is a variant, or the Omicron is new and different in some way? And so I think our community is really interested in knowing what's the best way to keep our entire family safe when PCSing or traveling anywhere during the surge.
Well, sure. I mean, hopefully you're going to hear the same things coming out of me, no matter what the situation. The first is vaccinated and boosted if appropriate. Single most important step. But about Omicron, as you've already described, this particular variant, transmissibility, or its ability to go from one person to the next, is much, much, much higher. So therefore, what are the sort of common sense things, right? These are the same things your mom and dad told you when you were a kid. If you're not feeling well, isolate yourself and consider testing. If you're feeling fine, but you're out somewhere else, be careful about it. If you're in a place not with your family, then, wear your masks where appropriate, in grocery stores or to the restaurants, at least, while you're not eating, or when you're out to a show, that sort of thing. Where appropriate, maintain physical distancing. Sometimes social settings is not appropriate to be apart. Sometimes it is. And so, think that through. Wash your hands or use hand sanitization if you don't have access to soap and water. So just the sort of common sense things that we collectively can control our own environment. It doesn't mean lockdowns. It doesn't mean you can't see your friends. It doesn't mean that you can't live life. But if you're going to be around immune-compromised family or friends, think about that and think through what are the things that you need to do beforehand. If you're traveling through high vaccination, low positivity rates, you can probably behave a little bit differently than when you're traveling through low vaccination, high transmissibility. So just be aware of the circumstance, right? We're in the military. Situational awareness is an important part of who we are. But if you're vaccinated, and boosted where appropriate and not immune compromised, your risk or the risk of your family, if that's all of you, to a severe case of COVID is extraordinarily low. And that'd be my advice to anybody who's moving anywhere, PCS, travel, TDY, whatever it is.
Thanks, Jerome Place. That's a exceedingly sound advice. And I know that our community appreciates you taking time to talk with us today. This is an important and I think pivotal moment for our country and certainly for our military families and our veteran families. So to have you to come on here, to have Secretary McDonough and other senior leadership, have Dr. Fauci come and talk to us in this way, it's just so meaningful and impactful. And we can't thank you enough for taking time to talk with us today. And you certainly have given us a lot to think about and certainly more than enough information to stay safe, get vaccinated, and get boosted. Thanks.
Yeah, thanks, Kobe. And I really appreciate your invitation to come on. It's always great to talk to you, the great Red Cross team, and in support of Blue Star families. So thanks for having me.
Well, super. Thank you so much, Kobe, for sharing the hosting duties with me again. You make us look good. Thank you, Lieutenant General Place. Really great information. And I have to say, for me personally, and I hope for you, our friends who are in family who are joining us today, for me, getting this information was a little bit like a booster in and of itself. I feel a little bit more motivated to keep going. In some ways, this reminds me of how I sometimes had to think about things back in the early days of the surge and those multiple deployments to combat. You gotta listen to the words of Janis Joplin and tell people that a woman can be tough, and the case may be a man can be tough. All of us can be tough to keep this thing going and keep fighting the fight we need to fight to keep ourselves and our force safe. Thank you, everyone, for joining us today. We hope you got the answers you're seeking. Blue Star Families is committed to standing beside you, military and veteran connected families, as we deal with the critical concerns that affect you, whether they're COVID, whether they're managing a PCS, moving with children, dealing with Afghan allies, or so many other issues. We hope you join us in some of our future engagements. We wish you health and happiness throughout 2022, and know that all of us together will get through this. Thank you.